In this video, we'll discuss about Truelove and Witts Severity Index for ulcerative colitis, and we'll learn an easy mnemonic to remember the components of this criteria. Ulcerative colitis is a chronic inflammatory bowel disease characterized by inflammation and ulceration of the colon. The Truelove and Witts criteria was established in 1955 by Truelove and Witts, and it is a widely used criteria to assess the severity of ulcerative colitis during acute flares. And this criteria also helps in determining the appropriate treatment and monitoring of the disease. This criteria classifies ulcerative colitis into three categories: mild, moderate, and severe based on the following parameters: bowel movement, rectal bleeding, and the four features of the systemic upset including temperature, pulse, anemia, and ESR. This is a table showing Truelove and Witts criteria. So the components of this criteria can be easily remembered using the mnemonic F6 blood tape for severe ulcerative colitis. If you don't know what is F6 tape, this F6 tape is a type of adhesive tape. So the six components of this criteria are: F is for frequency of the bowel movements, blood is for blood in the stool, and this T is for temperature, A is for anemia, P is for pulse, and E is for ESR. Patient will fall under the mild category if the bowel frequency is less than 4 per day, and if there is no blood or no more than a small amount of blood in the stool, and if patient has no features of systemic upset. So if patient meets all these six criteria, then you can classify them as having mild ulcerative colitis. And in cases of the severe disease, the frequency of the bowel movement is more than or equal to 6. There will be visible blood in the stool, and the patient will have the fever more than 100.4 degree Fahrenheit, will have anemia with hemoglobin less than 10.5 gram per deciliter, and the pulse will be more than 90, and ESR more than 30. So the components of the severe ulcerative colitis can be easily remembered using the mnemonic F6 blood tape for severe ulcerative colitis. To say that patient has severe ulcerative colitis, patient should have the bowel frequency more than or equal to 6 and should have at least one feature of the systemic upset. That is, the patient should have at least more than or equal to 6 bowel movements with or without visible blood, and at least one of these four components, that is one of the components of this step. So if patient meets all those criteria, we can classify them as having severe ulcerative colitis, and those patients who do not meet the criteria for severe and mild ulcerative colitis are labeled as having moderate ulcerative colitis. I hope this video was helpful. If this video is helpful, please like, share, comment, and subscribe to our channel. Thank you so much.